In this women's imaging article from an illustrious multi-institutional group of frequent radiographics authors, led by Dr. Margarita Revzin from Yale University School of Medicine, the authors discuss a wide range of processes that can affect one or both fallopian tubes. The article begins with a table that lists the imaging modalities used in the evaluation of fallopian tube pathology and the specific indications and utility of each modality. Following a review of the anatomy and congenital anomalies, the article details benign conditions, beginning with pelvic inflammatory disease, the most common pathology affecting the fallopian tube. Illustrative cases include salpingitis and Tubo-ovarian abscess. Tuberculosis affects the fallopian tubes in 34% of cases. A beaded appearance of the salpinges with strictures and dilatation is characteristic. Hydrosalpinx, due to an obstructed tube, produces a pathognomonic cogwheel appearance on ultrasound, while MRI is helpful in establishing a diagnosis of hematosalpinx suspected from ultrasound. Following a discussion of fallopian tube endometriosis, tubal ectopic pregnancy is reviewed. Figure 13 shows a classic example on ultrasound. Isolated fallopian tube torsion is a rare cause of acute lower abdominal or pelvic pain and can mimic other more common conditions. On cross-sectional imaging, a torsed fallopian tube may demonstrate the following features: thickening of the fallopian tube wall, hyperemia or absence of flow indicating necrosis within the wall, hydrosalpinx or hematosalpinx within the torsed portion of the tube, a beak similar to sigmoid volvulus or the whirlpool sign, the presence of mucosal folds or septa within the cystic adnexal structures, representing a dilated fallopian tube, and finally a normal location and appearance of the ipsilateral ovary. Post-ablation tubal sterilization syndrome is a delayed complication of endometrial ablation for menorrhagia. Characteristic imaging features of post-ablation tubal sterilization syndrome include hydrosalpinx, hematosalpinx, or tubal inflammation that can be seen on ultrasound and, if occult, are better visualized on MRI. In this video, demonstrating post-endometrial ablation tubal sterilization syndrome in a 48-year-old woman, post-contrast T1-weighted MR video clip obtained in the axial plane demonstrates an enlarged uterus with a complex hyperintense fluid collection in the endometrial cavity compatible with hematometra, denoted by the red asterisk, and bilateral dilated tubular structures with hyperintense fluid, indicating hematosalpinges, marked by the yellow arrows. The section concludes with a discussion of imaging findings following tubal occlusion procedures. Moving to neoplasms, the authors review the origins of low and high-grade serous neoplasms of the tubes, ovary, and peritoneum. Primary fallopian tube carcinoma is hypointense on T1-weighted images, isointense to mildly hyperintense on T2-weighted images, and shows mild to moderate enhancement on post-contrast imaging. Local gynecologic tumors of the ovary, uterus, and cervix, and non-gynecologic tumors of the colon and breast and lymphoma can result in tubal metastases. Figure 29 provides a summary algorithm on the approach to suspected fallopian tube pathology.